The surgery part, removing the fibroid.
Yes, so you have to remove the fibroid, and it should not be done during the pregnancy. Yes, so the fibroid can be operated on. There are some cases of recurrent miscarriages due to looseness of the cervix, what we call incompetent cervix. Now, those ones, the stitch can be put in early pregnancy before the pregnancy is beyond 14 weeks.
Where do they put the stitch?
They put a ring stitch on the cervix.
To close it, help it close?
Yes, it is expected to give a support to the muscle of the cervix so that it does not loosen out and give way. Yeah, so if it is recurrent, sometimes you have to put that earlier. Before even the person is pregnant, sometimes you can do it. Yeah, you put it, but through maybe laparoscopy also inside. And it remains there so that when the pregnancy comes, it just sits on it. It is safe,
it just sits on it.
Yes, so there are those ones where you have to do operation like that.
Okay.
Or abnormalities of the uterus, like where there is a septum, so you have to cut off the septum to make way for proper implantation of the baby.
Thank you.
Yeah, so surgery is very key, and it should be geared towards correcting the problem.
Thank you.
Then there's another big group, the
genetic
one. Genetic one. Now, as I've said, about 60% of the recurrent miscarriages can be traced down to abnormalities of genetics. Now, which means if a miscarriage occurs in an ideal situation, we must take the miscarriage product and analyze for you to know what type of genetic abnormality is this. Because some of these genetic abnormalities, they do repeat themselves. So if they have caused a miscarriage in this pregnancy, and they can repeat themselves, then they could occur in the next pregnancy.
In the next one.
Yes, if you
because you're living with it.
Yes, if you don't do anything about it. Yes. So genetic analysis should be part of the thing, especially if the pregnancy loss is earlier, like below 8 weeks. That should be, or around 8, but before 10 weeks. That should be done.
Okay, okay.
So it is very, very important to do that. Some of these genetic abnormalities, when you discover them, you have to do IVF to avoid them. Because you have to select the best embryos which don't have the genetic diseases, and then you put that embryo in the womb to avoid. Because some of these genetic diseases, you cannot still manipulate them.
True.
You can only avoid them.
True.
Yes.
True.
So that's where the IVF PGS comes
Applies in. Okay.
Yeah, but also very important is lifestyle choices.
Let's talk about the lifestyle choices.
Yes.
Choices like?
Now, lifestyle, the life and health of the mother influences the baby. For example, I earlier hinted that for a pregnancy to start, the mother should be in the best state of health. And it's very, very important. The mother should be in the best state of health and in the best state of nutrition. And this can be attained if you pay attention to what you eat, but also your life activities. What you recreate with, for example, drinking alcohol, smoking, those are not good habits.
How about sauna, steam bath?
No direct effect, really, but extreme of activities are not very good. Yes.
Okay, that's the lifestyle. Yeah. Thank you, Doctor. We have very many burning questions coming in. Good evening, Bethany TV. My name is Rukundo Grace. I'm kindly asking whether fibroids can stop someone from conceiving. And if so, is it possible to do IVF and carry the baby on my own? Because many doctors have scared me a lot that I won't give birth. I cry on a daily basis, almost though I'm not yet married. Either way, I haven't tried getting pregnant.
It depends on the type of fibroid you have. Maybe let's have this, there's some small illustration of the location. For the 3 illustration, yeah, this one here.
This one?
Yes, now this is, what is important is the size of the fibroid, but where it is located.
Where it is located.
Yes. Now, for example, a fibroid which is located like this one. This is the womb, the uterus.
Okay.
And the fibroid is hanging outside the uterus.
Out of the womb.
Yes. And the baby is supposed to grow here. Now, such a fibroid, as you can know, if it's not so big, will not affect the pregnancy.
Okay.
So such a fibroid, sometimes you don't even need to touch them. Yeah. So this is outside. Yes. Or it may be within the womb. Now, the one in the womb, in the muscle wall, like this, if it's very big, as you can imagine, it starts impinging inside. And such could have an effect. And these are some of those which cause recurrent miscarriages. So you find the placenta, the baby wants to attach, it's having issues, if especially it is big. But
if the fibroid is big.
Yes, because it is already having effects inside. But now, like this type here, this one obviously should be dealt with. A fibroid hanging inside the womb, that should be dealt with. So this analysis has to be done by the health worker to see if the fibroid is significant. Yes, and sometimes most times people have more than one fibroid, and so this will be analyzed in totality.